Hi, OAC community. I'm Kendall here with another episode of Fresh Perspectives. Today, I am going to chat with Dr. William Dietz about obesity, undernutrition, and climate change. Hi, Dr. Dietz. How are you today? Thanks for joining.
Nice to see you.
So, can you tell our viewers a little bit about yourself?
Yeah, for 16 years, I was the director of the Division of Nutrition, Physical Activity, and Obesity at the CDC. And after leaving the CDC, I came to George Washington University to the School of Public Health. One of the activities that I picked up along the way was to become a co-chair of the Lancet Commission on Obesity. And we released a report that was the product of about 3 years of work and published this in the Lancet. And the title of the article was The Global Syndemic of Obesity, Undernutrition, and Climate Change.
So, you've referred to the co-occurrence of obesity, undernutrition, and climate change as a global syndemic. What is a global syndemic, and how are these three things related?
A syndemic means, and we classified the whole issue of climate change as a epidemic because of the reach and severity. The syndemic in this case was the combination of obesity, undernutrition, and climate change. These three diseases, pandemics, interact in time and place and also have an adverse effect on each other and have the major effect on underserved populations. These are existential threats. Obesity is probably the most prevalent disease in the world. Climate change is ubiquitous and increasing. And all of these things contribute to undernutrition as well as poor health for both people and the planet.
And what are some of the factors that contribute to obesity, undernutrition, and climate change?
So two examples, one on the physical activity side and the other on the nutrition side. On the physical activity side, public transport generates about 15% of greenhouse gases. And those greenhouse gases contribute to lower crop yields and micronutrient malnutrition in the developing world and increasingly in the United States. So that's two of the three. The effect on obesity of car use is that it displaces physical activity. So that's the syndemic. Each of those problems have an adverse effect on each other. On the nutrition side, beef consumption, or beef production, I should say, generates about 8.5% of greenhouse gases. Beef consumption is associated with obesity, also with colon cancer and cardiovascular disease. And the increased methane that's released from cattle production has the same impact on the agricultural production system in terms of increasing or decreasing crop yields, decreasing micronutrient content of foods.
So, how would you say global decision makers should address this?
Well, I think we're seeing that global leaders are reluctant to take the kind of necessary steps to address this. I mean, these industries are powerful industries. The fossil fuel industry is responsible for keeping the taxes on gasoline low over time, which encourages car use, which discourages public or physical transport. The crop subsidies for beef continue to make those prices low and widely available. So we're not paying the true costs of food or the true costs of transportation because of the subsidies that these industries receive. I think increasingly the policymakers are beginning to respond to the efforts of Gen Z, which I see as the most powerful force for change.
And what are some things that our OAC TV viewers can do to take action against this global syndemic?
Well, certainly they should become involved at the local level. That's where change has always occurred, and I think there are lots of opportunities. For example, here in D.C., a bill just passed a couple of months ago for sustainable purchasing for food by the D.C. government, such that 25% of all foods have to reduce greenhouse gases by 2030. Transportation bills are not usually thought of as interventions around climate change, but they are. the more efforts that is put into cycling pathways for bikes, walkability, parks and recreation facilities, the more positive we can be about the impact of those things on climate change and reducing climate change. And a good example is parks. Parks have two or three benefits. The first is that the vegetation in parks traps carbon. And secondly, we know that proximity to parks increases the likelihood that people will use those parks and become physically active. So that's going to have an impact on climate change by reducing greenhouse gas emissions and increasing and improving physical health.
So it sounds like there's a lot of things that we can do at home to help reverse the global syndemic. Is there anything else you'd like to add?
The response to climate change begins at home. So it's what we consume, what we purchase, how we get around that makes a difference. And those are changes that we all can implement now. And one of the things that may not be obvious is that solutions to climate change are also solutions to obesity. Reduced beef consumption, increased physical activity are all climate change solutions. And in many respects, we may have more success in promoting these behaviors as climate change solutions than obesity solutions.
Thank you, Dr. Dietz, for your time today. It was wonderful chatting with you.
Well, you're welcome. Nice to talk to you.